My name is Kylie Hodges. I'm a registered nurse and I'm currently completing my Masters of Midwifery degree at the University of Canberra. This research proposal is for a component of that degree. The members of my research team include Samantha Treneman, registered nurse, myself, and our mentor and fellow researcher, Dr. Marjorie Atchin. We will be conducting a systematic literature review of the optimum treatment threshold for hypoglycaemia in full-term, asymptomatic neonates in the first 24 hours of extrauterine life. Our hypothesis is that there is not adequate research to support the currently most commonly used treatment hypoglycaemia threshold of 2.6 millimoles per litre, and we are therefore causing unnecessary harm and/or separation of babies from their parents by practicing to this threshold. Our research has evolved from an original review by Samantha Treneman in early 2022. We have noted that current policies and procedures are still referencing seminal research from 1988 to determine their thresholds. Current figures for risk factors for testing, such as maternal gestational diabetes, have doubled, resulting in a doubled incidence of testing of neonates. We aim to identify if current research can provide treatment thresholds that can ensure we are providing evidence-based care that does not cause unnecessary separation of babies or harm due to inappropriate interventions. We will be conducting our research in these 4 databases. We'll be using Confidence software to screen data with our outlined inclusion and exclusion criteria, using 2 rounds of screening to come to our studies for inclusion. We'll be looking at methodology in data extraction, and data will be extracted into a table and checked by a second researcher. Missing data will be acknowledged as a part of our results. 2 researchers will evaluate our data quality and results using the Crow Critical Appraisal tool to determine the inclusion of studies in our results. The results will be synthesized into a table and then structured narrative synthesis to facilitate recommendations for future practice. Our risk assessment looked at data and people. We have established risks and solutions for each issue to ensure data integrity and research completion. Finally, this is our timeline with final submission due by the 3rd of November 2022. Thank you.